that Indians are generally more vulnerable and susceptible to heart diseases and heart attacks. And in healthcare setups where we work, we've seen a drastic change that earlier heart diseases were supposed to be diseases of the old and the retired. But right now we see patients coming in with age group like as early as 30s or late 30s undergoing angiographies and angioplasties. So what are your views on it?
Fine. I have been criticized many times by people when I say that, as far as I am concerned, everyone is a heart patient past the age of 35, 40, unless proven otherwise. All I am trying to say is that it doesn't matter how fit you are, how strong you are, how athletic you are. Unless you have undergone a routine blood test, a ECG, echocardiogram, and a CT angio to prove that you have no early coronary artery disease or coronary artery anomalies, you are a suspect. Every day, so many people, young people, die in the gym running on a treadmill. So many people collapse in the field playing football or any competitive sports. These are needless deaths. They don't need to die prematurely. All we have to do is to accept that half the patients, especially in India, with coronary artery disease, suffer from silent ischemia. They may have critical blockages, but they are not aware of it. We have done the CT angio on nearly 30,000 patients, Indians. 1.5% of Indians have coronary artery anomalies. Their coronary artery comes from the wrong side. And one variety of the coronary anatomy wherein there is a malignant course where the coronary artery goes between aorta and the pulmonary artery. If they exert, if their pressure reaches up to 180, 200, they can have a ventricular fibrillation. And huge number, 1 in 500 people have hypertrophic cardiomyopathy. There may not be an obstruction, but they have a hypertrophic cardiomyopathy. A simple ECG will show. So it is not the question of the how fit or how strong, how athletic you are. You may run a marathon race. That doesn't mean anything to me. I want to see your ECG. I want to see your echo. I want to see your CT angio. All I see so many I live in the middle of electronic city. Young people who drink like fish, smoke like chimney. Company says you go for a test, the routine test. They get the echocardiogram, it's normal. They get a stress test on a treadmill. They come with a normal report. And 3 months later, they drop down dead. Because stress tests will not show 30%, 50%, 60% blockage. And if they bleed into that plaque, they die. I understand the radiology, the exposure to radiation in a CT angio. You need to get it done once in 10 years. That is nothing. So I am of the strong opinion that every Indian past the age of 25, 30 has to undergo these 3 basic tests.